Earlier this year, in March, we celebrated the 25th anniversary of the Beijing Declaration and Platform for Action. It was an opportunity to celebrate the significant progress that has been made in terms of women's rights and equality. We recognised the improved health outcomes for women, such as reduced maternal mortality and lower rates of FGM. It was also an opportunity to recognise the important work of a new generation of activists who have helped to break down barriers and raise awareness about period poverty and sexual harassment. And yet even back then, in March, before the height of the coronavirus pandemic, we recognised that the journey is still unfinished. There is still a lot of work to be done. Women and girls around the world still face social, political, and cultural barriers. And these vulnerabilities have been exposed in the harsh light of the coronavirus pandemic. It's true that mortality rates for COVID-19 are higher among men. Men represent 57% of the deaths and 70% of intensive care admissions. And yet, women still bear the brunt of the social and economic consequences. We need to consider the consequences not just of being infected, but also of being affected by the virus. Antonio Guterres has already warned that COVID-19 could reverse the limited progress that has been made on gender equality and women's rights. UN Women is deeply concerned by the health, economic and social impact of the pandemic on women and girls. First, there is the obvious health impact. While it's true that the mortality rate is higher for men, this should not disguise the fact that women are suffering from the virus too. In fact, women make up 70% of the healthcare workers globally and 80% of nurses. These are roles that bring them into close and prolonged contact with patients. Furthermore, they are 2/3 of the global paid care workforce, not to mention unpaid care. And these are roles where there has been limited access to PPE to protect them. So the underlying inequalities mean that women are more likely to be exposed to the virus, which we now know can become chronic, causing long-term fatigue and other problems for sufferers. But the health impact goes beyond the direct impact of COVID-19. Women are the primary caregivers around the world, and as such, maternal health is closely linked to the health of their dependents, of women's dependents. Women are now staying away from health centres for fear of infection, or because lockdowns mean they simply cannot get there, which has led to a rise in severe acute malnutrition among children. This has been compounded by the suspension of visits from community healthcare workers. It's something we've seen before. In Sierra Leone, during the Ebola outbreak, for example, fewer pregnant women accessed healthcare, which led to increased maternal mortality and stillbirths. But the pandemic is also impacting sexual and reproductive health, including abortion. Mary Stopes International has estimated that 9.5 million women and girls may be prevented from accessing their services, contraception and safe abortion, during the pandemic. And what's tragic about this is that a recent study has shown that we had been making progress in this field. Since 1990, there's been a significant drop in the numbers of unplanned or unwanted pregnancies, thanks to a push for access to contraceptives. But the pandemic could reverse all of this. Governments are shifting their funding away from essential sexual and reproductive health services. Some clinics have been closed due to lockdowns. And in some parts of the world, such as some US states, the lockdown is being used to pursue an anti-abortion agenda. All of this will lead to more deaths due to unsafe abortion and more deaths of newborns. But what about the economic impact? Women around the world lack job security. They tend to earn less, they save less, they hold less secure jobs, they are more likely to be employed in the informal sector, and they make up the majority of single-parent households. In fact, evidence from the UK shows that women were 1.5 times more likely to have lost their job during the pandemic than men. Insecurity is all the more devastating in developing countries. In fact, in such countries, over 2/3 of female employment is in the informal sector, jobs that are likely to disappear quickly in a pandemic. And the impact of this is even more severe. In developing countries where people lose their employment, they simply go hungry. An example of this happened in Liberia during the Ebola outbreak. Most of the market traders in Liberia were women, and they were the first to go when the pandemic affected their jobs. This led to higher unemployment among women, and it took women much longer to re-enter the workforce after the end of the pandemic, which raises a worrying prospect for the future. In fact, projections already show that there is likely to be a 9.1% increase in poverty rates among women due to the pandemic, which is why we are sounding the alarm. We are facing a situation where women who have escaped poverty are now at risk of falling back into it. And then there are the social consequences. It is estimated that 243 million women have experienced physical or sexual abuse at the hands of an intimate partner in the last 12 months. This situation is compounded by the fact that many women are locked down with their abusers, and some of the services to support them have been cut back. For example, within 1 week of France instituting its lockdown, there was a 30% rise in reports of domestic violence. The closure of public spaces removes checks on what goes on behind closed doors. And this is particularly the case for schoolgirls. Schools provide a safe environment for girls. They can distribute sanitary towels to ensure that girls are not restrained by menstruation taboos from pursuing their education. They can also represent an important point of contact outside the family. And yet, UNESCO estimates that 1.52 billion children have been prevented from attending school during the pandemic. When they are out of education, girls faced a heightened risk of FGM. They are more likely to be married off early. And all of this will lead to higher levels of teenage pregnancies, more STIs, and a reduced economic potential for these girls. As schools close and the countries are locked down, opportunities for paid employment are limited, which means that girls are more likely to shoulder additional responsibilities at home, domestic duties, childcare, care for the sick. The reality is that many of these girls who are out of school will simply not return. So, while the direct health burden of COVID-19 is tremendous, we cannot let it distract us from other pressing issues. Otherwise, the progress that has been made over the last 25 years will simply be eradicated. We need disaggregated data that can help us understand how women specifically are affected by the lockdown and by measures to contain the virus. This will inform our policy response and help us better target measures to support women. We also need to recognise that sexual and reproductive health services are essential. They cannot be cut back. A recent report from the UN database showed that too many countries lack sufficient measures to address problems affecting women specifically. We need measures that will address violence against women and girls, that will support unpaid care workers, and that will strengthen women's economic security. This is an urgent call for action. We now have an opportunity. We can transform this difficult situation into a new social contract which prioritises social justice and gender equality. Thank you.